This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Hello, good evening, everybody. While we get our presentation up, I'm Diana Molinares. I'm the Program Director at University of Miami. It's a pleasure being with you tonight. And I have the honor to be here with our two chief residents, Dr. Bremworth and Dr. Kurtowski. And we are very excited to share about our program. You're gonna hear about the robust academic training that you get and the diversity of patients and pathologies that we are exposed to. You're also gonna hear about the different settings where you are training. One of them is our community-based hospital, which is Jackson Memorial Hospital, our private academic institution, which is University of Miami, the VA, and a private hospital, which is Mount Sinai. You're gonna learn about the one-on-one training that you get with the attendings and all our wellness initiatives as well. But most importantly, you're gonna get to know the heart of Miami and our PM&R family. So with that being said, I'm gonna give the turn to, I think Dr. Kurtowski is gonna start first, and we're gonna be here for questions.
Okay, so I'm just going to talk a little bit about the facility first and how we're structured in terms of our education and didactics. So we're contracted through the Jackson Memorial Hospital. This is the main hospital. It is a huge, huge health system. We're also a level 1 trauma center, which is fantastic because we really get great rehabilitation exposure because of this. And then we do have a standalone facility called the Christine Lean Rehabilitation Center, which is a 72-bed facility. And that's the picture on the right that you see. It's really a beautiful building. So as Dr. Molinares was saying, we do get a really diverse training in terms of the different health systems that we see. Jackson Memorial Hospital is really a community-based program. So we see a lot of the underserved population there. Through the University of Miami, we kind of get this like private academic setting as well. Then the Miami VA system, we're getting a government military exposure for rehabilitation needs as well as different complaints. And then Mount Sinai is a completely private inpatient rehabilitation center. So we really get all these real world different health systems that really prepares us for any job that you want to do. So in terms of our location, even though we get all this diverse exposure for different health systems, 95% of our sites are all located in one campus. So there's really minimal driving. So if you look at the map, all these like little marks here kind of see where the hub of our rotations are, and you can pretty much walk to all of these throughout the day. So the big takeaway is minimal driving for all of our rotations. This is really the state of our facility, and this is kind of our home. So as you see, we have plenty of windows. This building has 9 floors that are dedicated to the PM&R department, and this includes 3 inpatient floors that tend to be divided by different service lines. We also have a floor dedicated for outpatient clinics, and then 3 floors of gyms, which includes an inpatient pediatric gym and outpatient gyms, which also has outpatient pediatrics, and then a full inpatient gym that is used by our inpatient adult patients. The great thing about this is that even though we're a standalone facility, we're actually connected through a tunnel to the main hospital where a lot of our patients come from. And it also is where the cafeteria is. So in this, Florida weather, it can get kind of crazy. Sometimes it rains, it gets really hot. We can actually just stay indoors and commute through one hospital to the other. These are just some pictures, so it's a really great environment for patients to be in. There's always windows. Most of the time it's very sunny here. So it really creates this like very vibrant and fun environment where you feel very motivated to do things. Just some more pictures. So all of our patient rooms are private. This is just a picture of about how the patient room looks. And then we also have plenty of outdoor spaces. This is just one of these where you can go out to eat. A lot of times patients are out there with their therapists, so it's a really nice setting to work in. We also have a pool where you can kind of see through this. So this is a really cool feature that we have and offer to our patients here. And then this is kind of getting to the gist of the program. So we have a lot of strengths here. We've been around for over 15 years and we have grown through this. And each year we continue to improve on our program. We're an SCI model system. We have plenty of diversity here, and this extends beyond of where people are coming from. Our patient population is very diverse. The pathology that we see here, the residents and the faculty. And what's really nice, we also have faculties of different levels, aside from the fact that they're coming from different parts of the world or country. In terms of the procedures, we start getting very early exposure to procedures in PGY 2-year, and you kind of continue to build this on as you progress. We also have fellowship trained attendings in all subspecialty and in-house fellowships for spinal cord injury, brain injury, cancer, and a very close relationship with the anesthesia pain fellowship. And then we, in addition to all this exposure, we also have supplemental courses for ultrasound. This kind of focuses on procedures as well as diagnostic ultrasound use, and then interventional spine. In terms of kind of what we've been working on and trying to grow, we have a lifestyle medicine residency curriculum, which is a brand new curriculum that we're starting this year, and it's an opportunity to become double boarded. We're going to go over into this a little bit more later on. We're also developing our sports medicine exposure through adaptive sports, as well as just regular sports, and building more relationships with this. We have dedicated research time, and then we have prosthetics and orthotics that we're continuously working on, forming these stronger community collaborations and expanding our clinic. So for our structure, we have inpatient rotations that have spinal cord injury, brain injury, comprehensive rehab, which is going to include LVAD and mostly transplant patients, stroke rehab, cancer rehab, ped service, consults, and then through the VA, we kind of get this more of a general rehab and spinal cord injury. And then we also have the Mount Sinai private inpatient rehabilitation. And then our outpatient stuff, we're pretty much really getting everything. We have a pediatric cancer rehab clinic, spinal cord clinics, brain injury and stroke clinics, P&O. We get EMG nerve conduction. We do neurotoxin for spasticity as well as for migraines. We also get backlift and pump training. We do interventional pain and spine rotations, and then we have ultrasound and MSK procedures. So it's a really well-rounded program. For electives, this is a really, really unique feature. So we do 4 in-house electives, and then we can do 4 away electives, which can really be anywhere in the world. And if you don't want to do them away, that's fine. We have plenty of in-house options, so you can use 8 weeks for in-house if you want. So the biggest takeaway from these slides is that, you know, during your PGY 2-year, you really have a nice balance where you go alternating from an inpatient to an outpatient rotation. And this creates a lot of balance in your routine, especially as a PGY2, where you tend to have a little bit more of a hectic schedule. And it really prepares you for your future because you're getting this early exposure that you're going to be able to build on throughout the years. As PGY 3 and 4, you do a little bit more of outpatient rotations. However, you're still maintaining that inpatient exposure. So if you are looking to get into a job of an inpatient setting, you're still going to be prepared for that and not feel like you haven't seen that in a couple of years. So our calls and night flow, we do in-house calls, which really prepares you to be ready to do any emergencies, just because you really don't know what kind of setting you're going to work in. And the really nice thing about here is that as a PGY2, you're doing most weekends and holidays, but this means that you're not taking any post-call days during your weekdays, and it doesn't take away an education opportunity for when we have our didactics. As a PGY 3 and 4, we have a night float schedule that is built in where you have no daytime clinical responsibilities. So this really helps with the whole sleep pattern. You're not constantly shifting from days and nights. So it's just a really nice setup where you're still getting to learn and you're not feeling like you have to catch up to your sleep and then still do daytime clinical responsibilities. Our didactics and educations are very well rounded. So we have protected time where the attendings will actually hold our phones. So we never get bothered by anything that is going on the floors during this time. And this is every Friday morning. We have an 18-month schedule where we see most of the topics twice. And then we also have plenty of supplemental discussions, as well as a weekly Cucurulo board review and essay review series. And then we'll have a semi-annual mock oral exams as well. And we have had 100% board pass rate with this structure. And then for research, we have a research day where all the 3s and 4s present their original research projects. We have a QI day. We receive great mentorship for both of these. And the really unique thing about our program is that we have a dedicated research block that you will do as a PGY2 or a PGY3. And during this time, you're really just expected to work on your research project, get the idea, and we have great university support with biostatisticians, librarians, and there's plenty of mentors, as well as a dedicated person who helps you run through these projects.
All right, hi you guys. I'm Caitlin Brunworth. I'm the co-chief to Sarah Kurtevsky. So I'll be taking over at this point to describe some of the extracurricular activities that we have at the University of Miami. So as mentioned earlier, we have some hands-on education. A lot of this is resident-led. So first off is the interventional spine course. So this is where we go in, we use the actual C-arm, and we have 2 different dummies that we use to practice driving the needle under fluoroscopic guidance. So that's all hands-on, resident-led, but supervised by attendings. It's nice to be able to practice these skills in a safe space where there's not actually a patient in the room, so you can ask any sort of questions. In terms of other hands-on courses, we also have a monthly ultrasound course. So this is for musculoskeletal ultrasound. Again, resident-led, attending supervised. So it's another opportunity for leadership within the program. When you're a PGY3 and PGY4, you can get involved in teaching for these courses. We also have an OSCE examination. So we basically have a pre-test and a post-test to assess everything that we've learned. And new this year, we have a little toy called the Phantom, which is kind of like a little box of Jell-O, where we're going to be able to practice needle driving under ultrasound guidance. In addition, we very frequently have different reps come by and they do different workshops with us. So we have a backlift and pump workshop where we practice interrogating the pump and accessing the pump. We have spasticity and Botox workshops, both for spasticity and for migraines. And then we also have a course in osteopathic and manipulative medicine, which is for everyone. So the MDs can get an introduction and the DOs can continue to practice their skills. So brand new this year, as Dr. Kurtevsky already mentioned, we have the lifestyle medicine curriculum. So this was born out of resident feedback that we were all really into kind of preventative care, exercise, nutrition, etc., and how that could impact our rehab patients. So in conjunction with the family medicine department, they've introduced this curriculum, which is brand new this year. So this presents to us an opportunity to become double board certified. So we can take this board's exam after our PM&R boards in November. And we are one of 14 PM&R programs that offers this. It is optional, so not everybody has to do it, but it's an optional curriculum during PGY3 and PGY4 year where we do online modules, patient encounters, and application activities. Next, in terms of teaching opportunities, we have a very, very close relationship with the University of Miami Medical School. So we have rotating medical students throughout the year, both on the inpatient and the outpatient. So tons of opportunities for teaching. We host hands-on events with the PM&R interest group at the School of Medicine. So we practice with them ultrasound, interventional pain, and EMG. We also have outside rotating medical students from various different schools, as well as international observers. So plenty of opportunities for student mentoring. Next, our residents are very heavily involved in presenting their work at various different conferences. So we have an extensive but not exhaustive list of all of the conferences we presented at. This was only over the past couple of years. And here's our picture at AAPM&R in New Orleans last year. In terms of leadership opportunities, we have plenty. So within the institution, we have resident unions. So there's an opportunity to represent the residents' interest in there. We have graduate medical education and program evaluation committee. Within the residency itself, we also have ultrasound course director, pain course director, sports, adaptive sports, and medical student committee. So many, many options within the department. And then, of course, there's options for state and national leadership at AAP, PM&R, and then the Florida Society of PM&R. Next is community involvement. So this was a little bit lower when I first got here as a PGY2, as we were kind of bouncing back from COVID, but each year I've seen our presence grow at these extracurricular events. So we've become much more involved in sports coverage. Here we are covering the Miami Marathon, as well as Wadapalooza, like a CrossFit challenge. We also have volunteer opportunities to mentor medical students at the San Juan Bosco Clinic, which is a volunteer clinic for underserved. And next, last but not least, we have That Life of Miami. So obviously it's a fantastic, very vibrant international city that's super diverse and a ton of stuff to do. Sunny pretty much all the time. So a lot of our activities are outside. We have, in terms of the residents hanging out outside of work, we have barbecues at the beach. We have pickup sports. So this is us all playing volleyball. We have happy hour outings. We've had a couple of doggy get-togethers because we have quite a few residents with dogs, and even those without dogs tend to come. Dr. Molinars brought her kids last time. And then here's a picture of some of our residents attending a Miami Marlins game. So that is all outside of work. Within work, we have an annual Secret Santa. We started an annual gingerbread contest around Christmas. And then we also have a resident-led wellness retreat. So that's every year. All the residents get one day off of work and we all go do something together. Here are some more photos. This top left is our social media team, who is absolutely fantastic. You guys should all go give us a follow on Instagram. We have some residents and attendings all playing basketball together at Lynn Rehab. Oops, sorry, my light just went off. Then on the top right, we have some of us attending a dinner that was sponsored by one of the reps. We have a boat party. We have resident wellness day, our holiday party. And then in the bottom right here is a very special picture because this was us celebrating the match of all of our PGY4s last year. So that concludes our presentation, and we'd like to open the floor for any questions that you guys may have.
Yeah, the sports medicine. I see a question say, thank you for the presentation. Could you speak a little bit more on the sports medicine curriculum and what's new about it? So for the sports medicine, we are making a bigger impact in the adaptive sports. So we are working very closely with the VA and our recreational therapy group so that the residents can participate in sports medicine coverage and activity, especially when it comes to adaptive sports. So one of the things that we're doing differently is that in the past, this was not considered part of a elective or selective time. And now you have even an opportunity to take a couple of weeks to work with the adaptive sports team for coverage of that. So we have two directors, one director for sports medicine in general, that they work with a lot of high school events and other sports coverage. And then we have the adaptive sports that is a new kind of like branch of the sports medicine group. Do you consider COMLEX solely for DO applicants, or is it encouraged to take the steps? No, the COMLEX is good. We don't necessarily need to have the steps for that. We take into account equally USMLE steps and COMLEX. And somebody else asked me privately, but just in case somebody else have the question, the question was if we take IMGs. And yes, we are also open to IMGs. I am an IMG myself, so we are friendly to IMGs, to DOs, MDs, as long as you are good and have a good heart. Is there a specific policy on signal leave for the program? So on the curriculum specific workshops. Yeah, so usually we do OMMM during the MSK block. And we have Dr. Prince, who is one of our leaderships. She's in charge of the medical students. She's a DO, and she's in charge of running the OMMM course. And in terms of the signaling, we work on signals. We take them into account. So if you like our program, please feel free to signal us. I don't know if there's something more specific about signaling that you want to know. Just please let me know. You will be rotating in October, Justin. Okay, yes, excited to see you, Justin. I don't know if anybody else have questions, or is there a cutoff? Okay, there are more questions coming. Step 2, CK score cutoff. No, we don't do cutoffs for any test. We do a very intense holistic review of each one of the applications. So we are like 3 days, like concentrated, like focused for like 14-hour days on reviewing each one of the applications. The main thing I want to encourage you is to apply early, like don't apply late, because we review applications very early on in the process, and then we start sending the interviews as soon as we complete like the holistic review of all of the applications. They go through different phases of review, and there everything is taken into consideration. How can we get involved in the Miami project to cure paralysis? Well, if you are one of our residents, that's very easy. It's in the same building. Like your resident room is on the 5th and 1st floor. You actually have 2 workspaces. And the Miami project is on the 2nd floor. And they are constantly running different trials. And we have dedicated staff and faculty that focus on those projects. But also they have, because they are part of the model system, they have a huge database. So even if you want to do like retrospective studies or like cross-sectional studies and evaluate like the information that you have there, then you can do that as well. Oh, sorry, I didn't realize that those were direct messages. San Juan Bosco Clinic. Yeah, so PUI3 and PUI4 residents are encouraged or have the opportunity to participate in the San Juan Bosco Clinic. That's a very good way to close the gap of healthcare disparities. Also, like work as an attending with the medical students and kind of like give back to the community. Sorry, I want to be respectful all the time. So George, please feel free to cut me off at any time.
Yeah, thank you so much. And I know you shared some contacts for questions, as well as I know University of Miami is very active on social media. I get real jealous around November, December when I see some of the posts you guys have on your social media. But thank you so much for coming. I really appreciate it. It's great to see what's going on at the program.